In discussing the elderly, there's a few categories that we need to discuss. One is the social stressors, psychological stressors, biological stressors, as well as their patterns of drug use or alcohol use. Let's take a look at the social stressors in aging. In our society, aging is equated to obsolescence and worthlessness. Social disinterest in older people's needs. Receiving Medicare and paying for Medicare is an issue that is not a top priority within our society, if we were to be honest. The psychological stressors, when we're talking about working with the population of 65 years old and older, are the issues of loss, separation, retirement, loss of bodily functions, somatization, where the emotional pain within an elderly life is masked by physical ailments. The biological stressors include disabilities, arthritis, depression, diabetes, physical changes, impaired cognition, a reduction in their lung, kidney, and ear function. In talking about the patterns of drug use, it's interesting that amongst the elderly 65 and older, that they have the lowest rate of alcohol use. 10% of them smoke. Over-the-counter medications, it's very common. Prescription medication. 60% of the elderly population have prescription medications in their medicine cabinet and in multiple prescriptions. 2 to 4% of the elderly population meet the criteria for alcohol abuse or alcoholism. Now, when we're talking about treatment approaches and strategies in working with the elderly, it's very important to understand the impact and power of empathy and trying to find that commonality with this population, treating them with dignity and respect. I'm reminded of Carl Rogers' approach, the Rogerian theory, where he says that once you develop a rapport and trust with the patient or client, especially the elderly, that treatment becomes unchallenging almost. And I think once we give them the dignity and the respect and try to find that common ground with the elderly population, we will find that it's one of the most rewarding populations to work with.